Hi everyone, hope you're all doing well. Just wanted to go over a few things for week three, and actually I will probably at the end of this go over some of your quiz information as well. But first, I want to talk a little bit about the content included in week three. So let me blow this up here a little bit. I guess it's not going to let me do that. There we go. So Week three, we talk about the policymaking process. We also talk about agenda setting. So I'll talk a little bit about agenda setting first. So agenda setting is where we're really thinking about, from a policy standpoint, what types of things we need to set policy on. So, like right now, today in federal government, some things that are important are the opioid crisis, things related to pseudo socialized medicine. I don't want to say socialized medicine because I don't honestly think we'll ever get to that in our lifetimes here. But those types of access for all type plans. And keeping costs down. So those three things, you think about those three things together in a policy bucket, and providing coverage to all, dealing with a massive social crisis in our country, and keeping costs down. They don't all really go together. So when you're going through that agenda setting process, it's really about what decisions, deciding what to make decisions about. So here's how we're going to set the agenda. These are the things we're going to deal with at this time, because we can't always deal with everything that's pressing. Right now, and as we talked about last week in the classroom, the agenda setting and legislative process, policymaking process is very political. So right now, it's all about, okay, what looks good for those that are running for president in 2020, what looks good for Trump, assuming he's, and obviously we know he is seeking, re-election, and then all of the folks that are looking to run against him, be it folks that are Democrats, folks that are independents, folks that are outside of those two, of the normal constraints. But how do they set their agenda to put together, so that the assumption is, okay, if this person, if Bernie Sanders were to be elected, we already know what types of things he's going to pursue. He's going to pursue Medicare for all. He's going to pursue, and outside of the healthcare realm, but getting rid of folks' student loans and those types of things, assuming the government can afford it. And that's where I question where any of that could happen. But same kinds of things. You look at Trump and how they're kind of positioning their administration right now to try and deal with some of these pressing issues that were pressing issues 3 years ago as well, but they kind of took the back burner until, again, it's time to set the agenda for this coming year. He wants to put out a good face. Although over the last couple of days, I don't think he's been doing that necessarily, but he wants to put out a good view of what types of things from a healthcare standpoint he wants to deal with. So his administration is working hard on that. So that agenda setting, and then ultimately that development of legislation, that can come a few different ways, and we'll talk about that in the end slides briefly, come to formulation of policy. So if we go back to this, I apologize, it's kind of fuzzy in here, but you've seen this in the text, and we looked at this last time. So this is this formulation phase right here that we're talking about, setting the agenda, and then ultimately, we have problems, we have possible solutions, and we have political circumstances. And those three things come together to move forward to develop legislation. There are problems constantly, and there are possible solutions constantly, but it's all about the political circumstances. How can this benefit folks? How can this benefit politicians that move things forward in the policymaking process? And how serious is it for our country? I mean, there are some things that it would be great to have, but they're kind of wants and not needs. Whereas, like, the opioid crisis is a good example of something that went from, it would be nice to deal with over prescribing of pain medication to, oh my gosh, this is a really pertinent, problematic need in our country right now, as opposed to a want. So Those political circumstances really drive this whole process. And as a fairly apolitical person, I find it difficult to think that we can't deal with all of the problems all of the time. But as a rational human, I realize we can't always do that. We can't even do that in our own lives a lot of the time. So when we talk about agenda setting, this Kingdon had talked to us about, it was in the text, but those three streams of activity. So problems, possible solutions, and those political circumstances that create a window for something to get on the policy agenda. So again, I just happened to be sitting and having some food, watching the news, and they talked about a new laboratory test that can test for Alzheimer's. Well, right now, I guarantee you that nobody's insurance is covering that. Or maybe a few that have very lucky, very broad coverage. But this seems like, okay, it's a problem, diagnosing Alzheimer's, possible solution. Okay, so right now we have a lab test that's come about that we know that works, but insurance doesn't cover it. So what's the solution? Well, we encourage insurers to cover it or legislate coverage, as we've done with many screening type tests. But that's when the political circumstances come into play. Is this the highest thing on the political agenda? Probably not. So we're not going to be dealing with that unless we're dealing with maybe a whole bucket of new types of screening tests that should be implemented at a certain age. Maybe when you get to the point where you're 50, you're having a screening colonoscopy, you can have this lab test done as well, and that will help to screen for Alzheimer's. So it's always that political, understand that there's always problems, there are always solutions, because there are some really smart people, yourselves included, that will be going into the healthcare field, and being able to deal with these things. But it's all about the politics and making sure that those political circumstances are in play. As I just spoke about, problem solution, that political force is sometimes required, or always required, to push forward for policy formulation. And when there's a crisis, those political circumstances can be most important when getting things moved forward. So when it becomes embarrassing to a city, town, state, the federal government, that they're not dealing with an issue, pushing forward that political thrust to make sure that things are dealt with. But then also on the flip side, when there are things that from a pure healthcare standpoint, from speaking to clinicians or even just ourselves as administrators working through, we're like, gosh, it really makes sense to deal with some of these issues. It's just not highest on the political agenda, and it doesn't move forward. Good example, there was a law, actually I have to thank Johnson, he actually had brought it up last week in a question he asked me about, there was a law passed some time ago about long-term care and making long-term care more affordable for people, and that law was kind of tossed to the side because there just wasn't funding for it out there. So long-term care, as I'm finding out, my father-in-law is in need of long-term care without funding for it. And with this law that had been in place, that the Obama administration put in place originally under the ACA and affiliated acts. I don't know which one exactly it came as part of, but it was going to create almost a national long-term care insurance network that people could buy into. Well, unfortunately, as they got to looking at it, these are great ideas, and there was a lot of political force behind it to get it to pass. But then when they looked at it, they're like, wait a second, we can't afford to do this. We can't even afford to have acute care for our folks that are on Medicare, that are on Medicaid, that are on various different types of health exchanges. So there's no way we can pay for long-term care. So the coverage for long-term care varies wildly. My father-in-law is currently in New York State, which is where I came from, where Medicaid, after a spend down of his assets, would cover his care in assisted living for in perpetuity. Here in Pennsylvania, that's not the case. So this is, but it's not a high enough it doesn't meet the standard of, oh, this is important enough to get a lot of political attention. It did as part of that. They got it through as part of that original bill a while back, but now, there's just not, there's no funding to put toward it. So it's something that, because of that political agenda, kind of falls to the bottom. Doesn't mean long-term care is not important. We have an incredibly rapidly aging population, and ultimately, I mean, there are many older folks that are staying much more active now, and perhaps won't need things like assisted living, personal care homes, those types of things. But there are many, the population of my parents. So I'm in my 40s. My parents are older. That population is who is aging, and unfortunately, they are still in need of those things. So just a good example of political force versus, we know there's a problem and there certainly is a solution, but there's no force behind the action. So one thing that can bring about that force that we need are interest groups. So interest groups are so important to setting the agenda and also the policymaking process for moving things forward when it comes to legislation. So obviously, we as individuals don't vote on policies. That's up to our policymakers, but we vote on our policymakers. So we want to make sure that we are informed about what our policymakers are interested in, and not just from a healthcare standpoint, but across the board. We need to not vote blindly anymore. A lot of people vote, oh, I'm just going to vote party line. I'm a Republican, I'm going to vote that. I'm a Democrat, I'm going to vote that. We need to not do that, because we need to be informed on what folks are interested in when they represent us in Congress or the Senate or our state legislatures, or our president, our governor, etc. We need to make sure that the people that we are voting for, the people that truly represent our ideals and what we would want to see from a policy standpoint. So, but there are also a number of interest groups. So one that I think of, for example, is this week in our classroom, we have I think it's this week, is that day in the life. We used to have a couple day in the lives in this class, but I think it's it was the woman from the nurse practitioners group from PA. So she has a very specific policy agenda that they follow. They set it as a group, and she works to help push that forward. But so things that are in her interest are things like the scope of practice for nurse practitioners in Pennsylvania, and work conditions and those types of things. So interest groups can be very important in pushing forward the agenda. It's interesting because just the other night, when I couldn't sleep in the middle of the night, I happened to be watching the movie The American President. So if you've never seen that, it's a great little kind of a rom-com type movie, but, well, it's not really a comedy, but it's a romantic political drama, I guess, if you want to put it that way. But the one woman in that represents an interest group. Now, it doesn't mean that she specifically has passion for environmental issues, which is what she represents, but she passionately represents her interest group. And that's how these interest groups work. Places like two of the most important lobbies in the healthcare world are the American Medical Association, who represent all of our physicians, and the American Hospital Association, that represent all of our hospitals. Also, another important lobby is AHIP, which is America's Health Insurance Plans, and they represent our insurers across the country. So these interest groups are crucial to pushing forward what they think is important. For example, to go back to many years back, and I think I've mentioned this in one of the other videos, when the ICD-10 coding process was being pushed forward via legislation, the physicians of the world didn't want to make that move. So they actually, through the American Medical Association, really pushed back and ultimately got, and not just on their work, but on the work of many different lobbying groups, got that delayed. So interest groups are so important to legislation, and they can really influence decisions being made. So there are tons of different interest groups. There are, obviously, I just mentioned AHA, AMA, AAMC, American Association of Medical Colleges, very important when we're talking about things related to students, medical students, etc. Also very important lobby. There are many groups when you think about people with specific diseases or conditions. So American Cancer Society, very important lobby. Different groups, like I have lupus, so there's unfortunately, I don't even know the name of it. I can see their logo in my head, but there's a group that specifically represents those with lupus. So they push forward, and there's not a lot of policy making going on in that realm, but they work to make sure that there's access to all for care, that there's access to all for insurance, those types of things. Obviously, older citizens, very important in pushing that lobby forward for that previous, I think it's called PLACE, the bill that wasn't in place to cover long-term care, which is and unfortunately ultimately was rescinded because the inability to pay for it. So all different interest groups exist, but at different levels of impact. AMA, AHA, AAMC, AHIP, very, very high level from an interest group standpoint, have a lot of impact. So they do rely on different tactics. Lobbying is one, electioneering, litigating, and then shaping public opinion. So lobbying is when we're talking about folks that work for these organizations, kind of infiltrating the government, getting in there, working with our congressmen, our legislators, different folks to make sure that that they as a body, as Congress, or it could be state legislators, could be local, depends on the issue, but they as a legislating body know what that particular lobbyist's employer is interested in. So, for example, the lobbying that's mentioned in our Day in a Life this week obviously is specific to nurse practitioners. So she's going to be pushing that agenda forward. You'll look at other lobbyists that are really focused on making sure there's access to care, maybe making sure there's long-term care available, and that can be paid for. A multitude of different things, but they use different types. Typically, like the example I gave from the movie The American President, that woman didn't have a specific interest in the environmental lobby, but she's very good at lobbying. She has the connections that put her in the right place, and she just pushes forward the agenda of the company that she worked for. So that's what lobbyists often are. They're not. They're professional lobbyists. They work for an agenda, and this week they might work for the AMA. Next week they may work for the steelworkers. So it's they can be all over the place, but it's not that they have a personal agenda, but oftentimes it'll very much feel like they have a personal agenda. Electioneering is another aspect that can be used with regard to kind of setting the agenda, and electioneering is all about providing aid to candidates for political office. So, for example, those that are interested in this country for a more socialized medical system are probably going to be using these types of interest groups are probably going to be using resources to back someone like Bernie Sanders for president, because he specifically has an interest in that socialized medicine type system. People that are interested on the other side of the coin, maybe that are interested in keeping things private and maybe just looking to smooth things out and make things more both safe but also effective and lower cost, may look to support some other candidates. So you'll see those interest groups, they can really channel a lot of money into a campaign, and therefore maybe turn that around depending on the outcomes of that. It has strict oversight, but it is certainly something that does happen. Litigation is another way. When you think about there was some litigation that occurred when the Affordable Care Act was passed that you may recall. When the Obama administration passed that, there were folks that came forward and questioned the constitutionality of it, of things like the individual mandate. So that litigation process, saying, okay, well, you have this specific interest in this policy, but we're going to litigate it and see if all the way up to the Supreme Court, which is where that went. Let's see what the Supreme Court thinks about this, because the judicial system isn't involved in setting legislation up front, but they're the ones that are really responsible for ultimately determining if legislation makes sense or not. So sometimes an interest group will challenge it right off the bat, and that's what happened with the ACA, and looking to see if it was constitutional or not. And the Supreme Court felt that it was. So there was nothing that came of that, but that was a big challenge for that law. And then shaping public opinion. All you have to do is look at ads from places like AARP or other types of organizations that represent us as a public, to see that they are looking to influence policymaking. You may see ads from American Cancer Society or other types of organizations, especially around election time. You'll see ads from teachers unions. You'll see ads from other types of labor unions. You'll see ads from just general interest groups that will try and kind of bend, and this is hand in hand with electioneering, but they'll try and bend your view toward a specific organization or a specific candidate, and they really do help to influence that policy agenda as well. So again, we talked about problems, potential solutions, and political circumstances. But what's important is that this process is very dynamic. It's in constant flux. It's not, we talk all the time about how if there's anything that's constant in healthcare, it's change. And this is one of the things that drives that. It's not, and I've said this a few times in this class, the people at those highest levels making these decisions do not have healthcare expertise. So it's really about who is able to get in front of, who has that expertise and is able to get in front of those that are making the decisions that take these problems forward and set that agenda. So as the last bullet here says, the result is a large set of very inconsistent policies, which is sadly what we deal with. I just want to talk about briefly the legislative process. I think it's chapter 6. It's the second chapter you have to read for this week. Talks about the whole legislative process. We've talked about it already a little bit, but this goes into more detail. I'm not going to go through the whole process. It's very much straightforward, step by step, but many steps process. There are 4 forms of legislative proposals. For making laws, we're going to have a bill or we're going to have a joint resolution. Now, if you're not familiar, if it's not something not everybody's into politics, not everybody's into legislation, I understand that. If you aren't knowledgeable about these, a really great way, and you may giggle when you hear this, but a really great way to learn about this process. When I was in school, when I was a kid, we watched videos that were called Schoolhouse Rock, and there's a video, and it's out on YouTube right now. You can go and see it. It's called I Am a Bill, and it talks about the process that a bill follows to become legislation. So it seems silly. In the past, I've actually put this in the classroom, but I don't want to offend anybody. But if you've not seen it, just watch it. It's a very simple way to learn that civics process and understand how a bill becomes law. And it's kind of silly and nostalgic and all in the same. But then there are also resolutions. So you can have resolutions, joint resolutions. I don't think I have. Oh, yeah, I do have this. You can have joint resolutions, which is, so the bill is going to be, it would be passed by, typically starts in committee. It would be passed by the committee of the House, committee of the Senate, whichever. Ultimately, they both have to pass the same version of a bill. Then it would need to go to the president, and then ultimately it would become law. Joint resolutions are similar, but a little different. They're not as much of a formal review, and often joint resolutions are the types of things that there is concurrence on between both houses, and oftentimes both parties, because that's what's important. And that it requires passage by both the House and the Senate, but by the notion of the fact that it is a joint resolution, it is typically, there is already support from both the House and the Senate. They move that forward, it would become law. We also have situations, go back here for a second, for things that are policy, non-binding policy or administrative type issues. We can have these other types of resolutions. So concurrent resolutions or simple resolutions, but those are really with regard to more administrative matters. And we'll talk a little bit more of that type of law. I think next week we talk about it. But these are types of things that don't have to go to the president to be approved. They do have to be, concurrent resolution needs to be approved by both houses, both the House and the Senate. Simple resolution is just one or the other, but they really only impact that house. So if the House passes a simple resolution that talks about how they're going to debate a bill, then it only impacts that particular situation. When it's something that impacts a broader situation, then they're going to have it passed by both houses, and then depending on the situation, perhaps by the president. But if it just impacts administrative operations of the Senate or the House, or both, it doesn't really typically have to go to the president for approval. So those were just a few things that I want to talk about. There is another chapter in here about the policy process that really talks about that policy formulation, policy implementation, modification, that whole process. Hopefully you'll find that helpful. Obviously, it's the lecture. It's going to be posted there. I do apologize for not having it up as quickly as I would have hoped. As I'd mentioned, I think I think I sent out a note to the class. We had a death in the family last week, kind of messed up our week for us, so I apologize for that delay. So discussion this week is a written discussion board, not a Flipgrid, so you'll be doing your written discussion. And we're almost going to create like little interest groups throughout the class, so hopefully you'll find this helpful. And so in your initial post, you want to post what type of public or individual health issue has most considerably impacted your family. Or if you don't want to post anything personal, just make something up. Oh yeah, I really, I want to support lupus. Dr. Harrington has that and I want to support that. Or, I really want to support cancer. I know I've had a lot of, friends that have been impacted by this, and I see nationally it's a huge issue, so I want to deal with that. So that's going to be your initial post. You're going to talk about that. But then your response posts are going to talk about, scroll through and look at all your classmates' responses and respond to them, and think about, okay, what types of interest groups can we create as a class? So if there are many that have been impacted by cancer, or maybe there are many that have been impacted by a social issue, maybe the opioid crisis. That's not even necessarily a disease, but a social issue that impacts health. So, or maybe just overall social determinants of health. So housing, food deserts, those types of things. So think about that. And then, how could the class interest groups contribute to health policy making? What do you think, probably your last post of the week, responding to somebody, what do you think would be the most powerful, based on maybe the number of people or the best arguments, whatever. So it's completely up to you how you want to do it, but those are the types of things that I'm looking for this week. We do have Lorraine Bach's Day in the Life interview, which is, she is, I'm not sure that she is anymore, but at that point she was. She is an RMU DNP graduate, and she is the president, I think, of the Pennsylvania Nurse Practitioners Association. And then we have a quiz. So that is our work for this week. If you have any questions, please feel free to reach out. Let me know. But otherwise, I'll look forward to seeing everyone in the discussions this week. I look forward to seeing what types of issues we have it's probably not a positive, I guess, but what types of issues we have as a group overall, and how we might be able to deal with them. So have a great week. We'll see you all soon.